Welcome to our 2021 Eurostar Awards. A warm welcome to you all. I'm Cathy Elliott, Trust Chair of Bradford District Care, and thank you to you all for joining us today to celebrate services and colleagues, volunteers and carers for all they've achieved over the last 12 months. I'm sure I'm not alone in thinking that we thought we might be back at the Mercure Hotel with tuxedos and sequins and partying together, but unfortunately for the second year in a row, we're running our ceremony online. I hope next year we'll be back together again without PPE to celebrate together. So we are online and we bring you our awards ceremony on film. Today we're celebrating our exceptional staff, service users, carers and volunteers. We're here to celebrate your work, your enthusiasm, your dedication, innovation and willingness to walk the walk and go that extra mile, whatever it takes to deliver outstanding services and our better lives together, despite all that the pandemic and the restrictions have continued to throw at us over the last 12 months. COVID-19 has tested us all again and again, and whether you've been working primarily from home, on a ward, one of our vaccination centres or in the community, we know how much so many of you have worked flexibly and met the challenges that have been presented themselves this year, and thank you. Yet again, we've had far more stars than we've been able to recognise in these awards, and we know because of the huge increase in nominations across the 6 categories of Eurostar Awards, as well as the regular nominations that come through for our monthly Living Our Values Awards. With the pandemic continuing to be a backdrop of our work, we felt it only fitting this year to include a one-off award to recognise the outstanding contribution to the Trust and the people we served during the pandemic, and so we have a COVID-19 award this year. Shortlisting and judging for the awards has been done online this year, and the Living Our Values finalists have been selected from monthly winners over the last 12 months. So today we bring you the ceremony on film. You'll be seeing our finalists on the screen shortly, and we encourage you to celebrate and congratulate them all in social media. So please use the hashtag YASA21, that's YASA21. So congratulations to everyone and to all the people, the teams, the carers, the volunteers who've been nominated this year. Well done to you. And I thank you also to everyone who's taken the time to nominate them. We really couldn't do this without you. Thank you. And as we celebrate our finalists today, I particularly just want to thank everybody who's working at the Trust and volunteering with the Trust at this time. Thank you for your flexibility, determination and passion at this time to deliver quality services for our communities. It is greatly appreciated. So we wanted to share with you some well-known local faces who particularly wanted to say thank you to you all today.
Hello everybody! Well, I bet you thought you'd be all dressed up in your finery, eh? Bow ties, sparkly frocks, sat in the Mercure Hotel. But no, here you are, watching me, Billy Pierce. But I'm saying a ginormous well done to everybody nominated for a Eurostar Award. You're all brilliant. And there's an extra big congratulations to those of you who are finalists, because you're all winners. Well, in my eyes, and loads of other people's as well. Do you know, it's been said before that this year is a year like no other, and boy, we've all felt that, haven't we? Haven't we? And in these difficult times, you've all risen to the challenge with true Yorkshire grit and spirit. So a big thank you for all you've done. We couldn't have got through this without each and every one of you playing your part. Yes! So before I get too emotional, I would just like to say, enjoy the celebrations. Brilliantly well done to each and every one of you, and I look forward to seeing you when I'm back on that stage at the Alhambra shouting, "Hey kids!" Brilliant, congratulations, well done. Ta-ra!
Hi everyone, we're Keith Cougars. We're just wanting to say thank you for all your hard work during this testing period. We really appreciate everything that you've been doing. We just want to say congratulations on your nomination for the Eurostar Award. Everything that you've done is deservedly achieved. So thank you very much from us again. You're all brilliant.
Hi all, it's John Lilly here from the Bradford Bulls. I'd like to take this opportunity on behalf of the Bradford Bulls and the Bradford Bulls Foundation to express our gratitude for the brilliant work you have all done and continue to do for the people of Bradford, especially in these tough times. So congratulations to all the nominees and to everyone who's provided such an outstanding care and service. You're all stars and all worth your weight in gold. From the bottom of our hearts, a huge thank you to you all.
Hi everyone. On behalf of everyone at Bradford City, we just want to say a big thank you to everyone at the Trust. The work you've done throughout the year has been excellent. I'd also like to say congratulations on the Eurostar Award, and a big well done to all the finalists as well. You're all winners in our eyes. Congratulations again on the award, and hope you can celebrate it. And again, thank you very much from everyone here.
I hope you enjoyed that message. So now it's time to crown our Eurostar and Living Our Values Award winners, each of whom will receive a trophy, certificate and funds to spend on their project, workplace or personal development. And as ever, the prize money for our winners is provided by Sovereign Healthcare, who've supported our Eurostar Awards for 17 years. So thank you, Russ Piper and all the team over there for your support. We also want to thank Taskmaster Resources. Thank you so much for your support over many, many years as well. We value your support to help these award ceremonies happen every year. So without further ado, we'll begin the awards ceremony, and we begin with the Unsung Hero Award. And that's particularly introduced by our Chief Exec, Therese Patton, and the Chief Exec of Sovereign Healthcare, Russ Piper. Enjoy the award ceremony and have a wonderful time in celebrating. Thank you.
Thank you, Kathy, and hello everyone. Russ and I have the great pleasure of introducing and presenting the very first award today to celebrate an unsung hero, someone who quietly goes about their work supporting the Trust, but who's been recognised by others as having that special something when it comes to helping us provide the best care. Ross has the golden envelope and will draw the name of our winner shortly. But first, let's meet and find out more about our special finalists.
My name's Craig Wilkinson. I'm a healthcare support worker here at the Assessment and Treatment Unit. The Assessment and Treatment Unit, for people that don't know, is people who have a diagnosed learning disability, but they're also, at the moment, they're going through some sort of crisis, whether that be a mental health crisis or some sort of crisis in the general behaviour, and that's making it difficult for them to function in society, really.
The reasons why I've nominated Craig is because since I've started, Craig's been one of the staff members that have kind of shone out above everybody else. If you have to ask Craig, to complete a task or anything like that, he's going to do it with precision.
If I won the award for Unsung Hero, yeah, it mean a great deal. I think it mean a great deal for the team here. It'd just be a massive honour, really. I expect, like I say, especially at this time, I feel there's so many people within the service that have done amazing, heroic work this year. So it'd mean I don't know what to say. It'd be an incredible thing, really.
My name's Christine Hawksworth. I'm the end-of-life educator for care homes and care agencies. I go out and support the care homes and care agencies around end-of-life and palliative care, deliver up-to-date resources and education, anything to do with end-of-life care, palliative care and care of the dying.
My name's Sinead and I'm a speech and language therapist in the paediatric team. I worked closely with Christine and she was an absolutely superb nurse and such an asset to the palliative care team. She's just so hardworking and she really brightened up my day, and she's just a fantastic nurse and so passionate about her job.
So it's been challenging because everything's been done over a computer or at least over the telephone now. So we're still talking to the care homes over the telephone, seeing if there's anything they need. And obviously the education took a little bit of a backseat because they had other things going on.
She's not all about sort of rushing through a caseload. She's about giving that quality of care.
So to be nominated for the Unsung Hero Award has been a privilege. And I'm proud to be honoured, but I do feel very humbled, if you like, in a way, because I was just doing my job. It's nothing, I didn't feel I was doing anything out of the ordinary. If I won this award, it would be a really big achievement, because I am now coming to the end of my career, so it would be a lovely time to win something as outgoing on to retirement, really.
I'm Beth Fernley. I'm Deputy Director of Patient Safety, Compliance and Risk at the Trust.
My name's Oais, and I joined the Bradford District Care Trust back in March 2020, so right at the beginning of the pandemic. And I joined on a graduate management trainee scheme. So I've been with the Trust for a year and been involved in various different projects. I began by working with the executives over at New Mill, and been involved in a range of different things with our response to the pandemic, our staff testing, our vaccination centres. So the day-to-day job varies quite a lot. It's a lot of different things that I've had the privilege of being involved in.
I've nominated Oais for the Unsung Hero Award because I think he's gone really above and beyond in what he does. So I first met Oais when I was in a slightly different role, head of patient safety role, and Oais had just started at the Trust. He's a graduate management trainee, so he's come here to get experience over a number of years. And he was working with Fran, who's our Deputy Trust Secretary at the time, looking at corporate governance. So not too long after that, COVID hit, and we all know what that did for us. Everything changed, everything went up in the air. We had to make really quick changes. And Oais has been absolutely central to that. And without him, there's so much stuff going on in the Trust that just would not have got done.
Yes, I'm absolutely loving the role. It's been brilliant and a brilliant experience for me, but it's been so great to work with brilliant people. And the nomination came as a complete surprise. So to me, it's a very sort of heartwarming thing. That it's been a great experience. If I won the award, I think it would, like I said, it would probably be a bit of a shock. But if I won the award, it would be such an honour to be recognised for working with such a brilliant trust.
What great work from all three of our Unsung Hero finalists. But unfortunately, there can only be one winner. Over to you, Russ.
I'm delighted to be opening the first golden envelope today and to tell you that the winner of the Unsung Hero Award 2021 is Oais Siddiqui. Congratulations, Oais. Very well done indeed. And well done to all the other Unsung Hero finalists. Your stories are all very inspiring. The next award is for working together, so I'll pass to Medical Director David Sims to introduce the finalists.
Thanks very much, Russ. Working together has been even more vital than usual recently to ensure services can continue to be delivered safely and effectively despite the challenges of COVID-19. Let's find out who our finalists in the Working Together category are.
So my name is Vicky Donnelly and I'm the Strategic Health Facilitator in the Learning Disabilities Community team. So I'm based at Waddy Loves most of the time, and then half a day a week as I work in the CCG as Clinical Lead for Learning Disabilities. So it's a nice mix of roles there. But my main role at Waddy Loves is supporting the whole learning disability team, I guess, and people with learning disabilities across the district to make sure that they get their health needs met, to make sure that services, hospitals, GPs, primary care, everybody are accessible to people with learning disabilities. I do a lot of work with the self-advocacy groups, working with people with learning disabilities themselves to find out what's going on across the district.
I always refer to Vicky as the person who steers the mothership, and that's exactly what she does. She is the most passionate, hardworking, caring and committed person you can ever meet, and I feel very honoured that she's my colleague. She pulls together everything for the team, from professionally, socially, but her biggest strength is her unfailing commitment to service users.
I would just like to say the nomination should be for everybody and not just for me.
I think if Vicky won the award, it would just be a really nice way to recognise the impact she's made on the lives of many, many people with learning disabilities and on her colleagues for many, many years.
It's nice to know that people think that the work you're doing is worthwhile and good. Yeah, absolutely. I was embarrassed, but I was also really pleased. It was nice to know that that's what the rest of the team thought. Yeah.
Hello, my name is Chris. I'm the head of the KPO here at Bradford District Care. The Care Trust Way Learning Week has been nominated for our Working Together award. We're really pleased with the Learning Week. We think it was a great opportunity for everybody to have a chance to reflect on how COVID's impacted them, their work, their personal lives. And it was just a really good opportunity for everybody to come together and have a chat about that. So it'd be really great to win this award, because what I really think that would do is give recognition for what the Care Trust Way represents. It's a way of working in the organisation. It's a way of having meaningful, purposeful conversations, and what that means for us as individuals and an organisation as a whole. It really reflects our culture and what it's like to work here.
So I nominated Anne-Marie Hargreaves, basically because she really supported us in developing kind of some new processes where we offered service user feedback via web links online, using text messages, via email invites to the survey online. But we soon found that not everybody has access to technology. Not everybody's confident in using, text messaging and web links. So we had a conversation with a few teams, and the Airedale Wharfdale team were really eager to kind of support us and pilot a really old traditional method of ringing people and talk to them about their experience of using a service.
My name is Anne-Marie Hargreaves. I'm a district nurse logistical administrator. I cover 8 teams, and basically I do jobs for the district nurses, which releases them to spend time on seeing the patients. It's been very difficult because I'm probably sometimes the only person that person may have spoke to in a week. If I won this award, I would be so proud. I feel to be nominated in itself, I'm proud, but to actually win would be wonderful.
All worthy finalists, I'm sure you'll agree. And the winner is the Care Trust Way and Learning Week team. Well done to everyone in the team. I'll now ask Sandra Knight, our Director of Human Resources and Organisational Development, and Alex Bourne from our sponsor Taskmaster Resources, to introduce and to present the Non-Clinical Stars Award.
Thanks, David, and I'm really delighted to be presenting the Non-Clinical Stars Award. And this award recognises the excellence that happens in our non-clinical services on a day-to-day basis, and those outstanding teams and individuals who regularly go the extra mile to support our frontline services and clinicians. So now let's meet our non-clinical stars and hear about some of their work.
So hello, my name is Chris. I am the head of the Kaizen Promotion Office, or the head of continuous improvement as we tend to call it these days. And my day-to-day job is working with people within the organisation, and more so at the moment outside the organisation, around improving ways of working, different ways of working, more efficient ways of working, and just try to improve the process. Giving people time to think is what I like to think I do a lot of. Coaching conversations, asking the right questions at the right time, and generally just having a conversation with people and understanding what it is that they're trying to fix, what challenges they face, and seeing how I can help with that.
Not just me, but I'm speaking to nominate, but our whole team and also wider outside our team are nominating Chris Hunt, who's the head of the KPO team, for many reasons, and he has been crucial really in generating a spirit and a culture of of improving how it feels to be part of Bradford Care Trust.
If I won the award, it'd be great. It'd be great recognition, I suppose. It's just good to get that positive feedback, that knowing that you're doing something is making a difference, and that it's making enough difference that people want to nominate you for something like this.
So my name's Dr. Suzanne Hayward-Everett. I'm a consultant clinical psychologist and clinical lead of the Primary Care Wellbeing Service. Cheryl Kirby is our team manager, and we work with complex physical and mental health difficulties, chronic fatigue, and currently long COVID rehab for care staff.
My name is Cheryl Kirby. I'm the service manager for the Primary Care Wellbeing Service, Tissue Viability, Falls Prevention Service and the Continence Service.
I think what's really fantastic about Cheryl as our service manager, and also she manages 3 other teams as well, the Falls team, the Continence team and Tissue Viability team, is that she's just very, very flexible and responsive as the team has been during the pandemic. So because a lot of the, because our team is a multidisciplinary team, we can work with quite high levels of complex situations. And I think we've been able to be very, very responsive to our patient needs, but staff needs as well throughout the pandemic, which has been really good.
I work with the team leaders and the clinical leaders of those services to support them and facilitate the delivery of efficient services, and also in any developments they might want to make. If I won the award, I'd be, to be honest, I'd be very shocked. There are so many more deserving people, I feel, both in my services and in the trust, but it would be very nice recognition.
Hi, I'm Keith Wager, the line manager of the distribution side of PP Logistics at our warehouse location at Cemetery Road in Bradford. I coordinate that distribution, coordinate the team that go out and distribute that stuff. So that involves, for them, it involves picking, packing, loading the vehicles.
I nominated the PPE team for the non-clinical stars category for the Eurostar Awards this year. And the reason that I did that was for the amazing work that this team has done in providing PPE to all teams across the trust, enabling them to work safely. The PPE team was formed rapidly, actually, in response to the COVID-19 pandemic, when this all started, what seems like quite a long time ago now. And what we needed to do was provide PPE to people that needed it right now.
If Paula and our team won this non-clinical award, it would be fantastic. I think Paula would be very pleased about it because of that support she's given us, and also we would be, over the moon with it because of the work. It would be a recognition of really, and I know all teams have been working hard through COVID, but it would be a recognition to us that we've been successful in getting that protection out to those vulnerable teams, if you like.
That's a really tough category. I think you'll all agree, and very hard to make a decision on those. In each one of them demonstrating how clearly they help to achieve the vision of our organisation and live our values every day. So now I'll hand over to Alex, who will open the golden envelope and announce the non-clinical stars winner.
I'm absolutely delighted to announce that the winner of the non-clinical Star Awards 2021 is, attention, the PPE team. Well done to each and every one of you in the team. I know you've played an immensely valuable role throughout the pandemic. Thanks and congratulations.
Thank you, Alex, and well done to the PPE team. Absolutely fantastic. So our next award is the Improvements and Innovation Award, and here to present it and announce the winner is Tim Rycroft, our Chief Information Officer. Over to you, Tim.
Thank you, Sandra. If ever there was a time for innovation and improvements to come to the fore, it's been over the last 12 months, and they certainly have. It's my pleasure to introduce the finalists for the Improvements and Innovation Award. Let's watch the film to find out more about them.
So my name's Catherine Jowett and I am the charity and volunteer lead at the Trust. I was just the volunteer lead, and then about 12 months ago I also took on leading the charity as well. So we've relaunched it and yeah, just really kind of growing the charity. So the charity is called Better Lives, and it is our own NHS Trust charity. We support the health and well-being of our service users, our carers, our families, our staff, our volunteers.
So my name's Stacey Pearson and I'm head of financial accounting. And the way that the charity fits in, I suppose, with my role is before we relaunched the charity, before it was Better Lives Charity, where we've relaunched it in the middle of the pandemic. It was quite a finance focused charity, so it was led by the finance team.
I think we've been nominated for the Improvements and Innovation Award because we've grown so quickly in such a short amount of time.
I think for me, looking when I first came into this role of what the charity looked like 2-3 years ago to what that looks now, the steps that we've taken, and it really means something now. The charity is so proactive.
If Better Lives Charity won this award, I think it would mean a lot just for the work that's gone in over the last few years to get to the point of being able to relaunch the charity with staff who have all got other jobs but are all doing this as an added extra. The charity is really starting to make a difference, and I think there's just such a fantastic opportunity to do so much more for our service users and our staff with the charity, and that's only come about because of the passion of the people that have been behind the charity, driving it and making this change to improve it.
So my name's Rachel, and I'm a specialist diabetes podiatrist, and we look after patients who are at risk of losing the leg or losing the toes or becoming septic from really severe infections in their feet.
Hi, my name's Michelle Pope. I'm a podiatrist working in the diabetic foot clinic team. I spend most of my time working with diabetic foot ulcers, which pose quite a big problem to the NHS. I think it costs about £1 billion a year to treat diabetic foot ulcers.
I believe Michelle and the team at the Diabetic Foot Clinic up at Airedale Hospital have been nominated for the work we've been doing to develop and use the Foot Selfie app. We were already using it before COVID, and the idea was it was something to let patients log onto a web page and they could upload photos of their foot wounds if, say, for example, they were dressing their feet at home. And obviously during COVID, it became invaluable because a lot of our patients were shielding.
I think a key factor in reducing the healing time is early access to the team. So to reduce this, we've transformed our approach and gave patients access to our new Foot Selfie. But the team has to look at the secure dashboard each day in and amongst their day job, if you like. And so they're doing extra work looking at this, but they're trying to see patients and triage them appropriately when they have problems.
I think if Michelle and our team won the award, I think it would be amazing because for everybody in the Trust, it's been a really difficult year this last year, and particularly for podiatry. Half our team were redeployed to help with the district nurses, which was challenging in its own way. And the rest of us who were left working for podiatry were working with the really, really high risk foot wounds. And it's been an intense year. And I think it would be a nice recognition of some of the work and some of the innovation and some of the ways that we've tried to look after our patient in this really, really difficult situation.
name's Natalie Irving and I'm a care coordinator in Airedale Early Intervention Team, and I'm a trainee CBT therapist as well. I'd had some problems with my own physical health. I'd started a gym, going to gym. I had a personal trainer, and I realised the knock-on effect it had on my own confidence, you know, not just about feeling fitter. And I'd been concerned for some time about the confidence, lack of self-esteem, all of those sorts of things with the people that I was working with. And I just wanted them to have the same opportunity that I did.
Nat took it online. She had the vision to take it online, which is what we started to do. And obviously, because we weren't paying for a gym, we got an extra session. So we now do it 3 times a week. And we all get together over the Microsoft Teams and do the same thing. We exercise together for an hour. And it's wonderful. There's obviously a need for it because, you know, mental health, it's good if you can exercise. It's all really good for you.
If Natalie won the award, it would be a well-deserved recognition for all the hard work that she's put in, not only in bringing the idea into fruition, but also with supporting the client group that we work with, supporting her colleagues to get involved.
The thing about Nat is she always puts the service users first. They're at the forefront of everything that she does, and she's so dedicated.
If I won the award, then I feel that I've done that actually on behalf of the clients at boot camp.
I'm really excited to be opening this envelope and to let you know that the winner of the Improvements and Innovations Award 2021 is the Foot Clinic team from the Diabetes Centre at Airedale General Hospital. Absolutely brilliant work. Well done to you all. And now to the Service User, Carer and Volunteer Contribution Award, for which I'll pass you to our Director of Corporate Affairs, Paul Hogg. Paul.
Well, thank you, Tim. I'd just like to say every year that people who are not members of the Trust staff share their time, their energy and their passion to help us deliver outstanding care. Their contribution does not go unrecognised. They are absolutely vital to our work. And I'd like to thank each and every volunteer, service user or carer who've been nominated in this year's awards category. Let's have a look at some of the finalists.
My name's Ted Wilkinson. I was born and brought up in Darlington in County Durham. Left when I was 15 and a half and joined the Royal Navy. I did 18 years in the Royal Navy and then joined the Fire Brigade after that. I initially found the volunteering side of it in the Daily Mail, and me and my wife saw that and thought it was a great idea, so we'll put our names forward to do that. I got a phone call asking me if well, first of all, did I have a clean driving license, which I did, and then I was asked, what's the biggest thing I've ever driven? So when I said a fire engine, well, she says, that's handy. So I said, well, have you got one? She says, no, but can you drive an ambulance? So I said, well, probably. I've never done one, but I probably could do. And she explained the situation that it's going to with the nurses, with the COVID nurses, taking 4 of them out on a daily basis, the different areas of West Yorkshire, but mainly Bradford, out as far as Keighley and etc. And just looking after the nurses and taking them from A to B safely.
So I've nominated Ted Wilkinson for the Service User, Carer and Volunteer Contributions Award because he shows such a commitment to his volunteering. Ted has previously volunteered for us pre-COVID and has always been really keen to volunteer for any different roles that have come up.
To me, to be nominated, it's rather humbling because I didn't do the hard work, I just drove the ambulance, but also very proud because it was a long haul. It really was a long haul, but it was worthwhile. I mean, I know it had to be done because of what was going on with COVID. I know it had to be done, and I knew the nurses had to do it.
So I'm Anita Bruin. I'm a consultant clinical psychologist and I'm currently employed as Head of Psychological Therapies for the Care Trust. So I've nominated Keith for the Service User Involvement and Carer Involvement Award because he actually represents both. because of the contribution he makes when he steps up. So he does step up really often, but it's the his ability to reflect on the needs of other people, not just his own needs and his own view. He's very good at representing a much broader view than that. He's very connected with other people who view services.
When I first heard that I was nominated for this award, I was a little bit shocked and humbled in a way.
If Keith won the award, I'd be absolutely delighted, because I think it would be a real recognition of the importance of the role that he takes on.
I'd be chuffed to bits if I won the award, but equally, I don't want to take anything away from somebody who is more deserving.
Hi, I'm Matthew. I'm one of the COVID Marshall volunteers within a trust. We work over at Marley Activity Centre in Keighley. We support the COVID vaccination and testing team, and we work with not just staff from the trust but all frontline workers, so private healthcare, police, fire, social services, for example.
I'm Julia Clayton-Stead, and I'm a COVID marshal at a testing centre for NHS staff. I meet the staff as they come for their weekly tests, or maybe they're coming for tests because they think they may have COVID. And I hand out the testing kits. Sometimes I make up the kits if we have time, and then direct them to the booths where they do the test and hand the tests in.
I have nominated 5 volunteer marshals for the COVID-19 testing team who have given up their time, approximately 15 hours a week, to help support the team at the Marley staff testing site. And each volunteer, who are Matthew, Sandra, Julia, Sally and Rosemary, have all given up their time during the week to willingly volunteer to help the staff team.
Right, if we won the award, well, I would feel proud, but also, again, quite undeserving of it, because it's just something I'm very happy to do.
Being recognised from other staff and from other organisations, and particularly from the trust themselves, makes a big difference. It kind of makes it feel like it's been worthwhile, and it's something what's never going to really happen again. So it's one of those things you can say, I did this when this happened.
Well, a huge thank you to all our finalists, and I'm delighted to say that the winner is Ted Wilkinson. Congratulations, Ted. Well, very well done, Ted. Now we move on to the Team of the Year category, and I'll ask our Chief Operating Officer, Patrick Scott, to introduce the finalists and draw the winner. Over to you, Patrick.
Thanks, Paul. Just want to say how great it is to be here again, to be part of this, the You're a Star Awards. Never been more important for us to recognise the talent that we have and within this organisation. Hopefully it'll be the last time that we're doing this virtually. So our Team of the Year award recognises the value of a great team, and it goes without saying that great teams have helped our trust get through the last year and ensure that we could continue to deliver outstanding care despite whatever COVID-19 could throw at us. The teams you're going to hear about now are more than a group of individuals with great skills. They are people who are creative, flexible and innovative, who have pooled their skills and worked together, who have simply not let the adversity we've all been facing stand in their way. So let's hear about our Team of the Year finalists.
I nominated us for how we've pulled together over the last year through COVID to support our service users and ourselves.
So the community mental health team help provide mental health support and assessments within the community. Our main aim is really to keep people well.
I think we've done really well throughout the pandemic. We've really come together. We're kind of like a big family, really. We sort of can tell when one another's becoming stressed out, and we'll sort of step in to help that person, and as well as maintaining face-to-face throughout the pandemic, and trying to support our service users. We do a lot in the team that's unique to just our team. Like, we run peer supervision sessions that are led by members of the team.
To be nominated, it feels amazing. Like, we didn't know Jenny had nominated us, and then all of a sudden we get this certificate, and we were all just so excited. Like, we didn't know we wanted recognition. You don't feel like you need it, but when you get it, it really was special. I just am in awe of my other work colleagues. Sometimes I think they're all so amazing. So it'd be lovely for me to get the award as part of the team, but also I'm just so happy for like my team members to be recognised as well, because we're pretty good. We're a pretty good team, I think.
My name's Kelly Riddles. I'm in staff nurse with the immunisation team. So we're the team that go out into the schools in the Wakefield area, and we provide all the immunisations for school-aged children in the Wakefield district. We've obviously had to rework the way that we work, that we think about how we could still get these immunisations in, to these children that need them. So during the first lockdown, we couldn't go anywhere, we couldn't do anything. So we decided that we still needed these children, they still needed consent, because as soon as schools opened back up, we needed to be ready to get out there and to see these children straight away. So we set about verbally consenting, which means we phoned up the parents of all the children in our cohort, which is around 4,500 children, 5,000 children, and set about ringing every single parent to try and obviously explain the situation, explain the vaccination that they are now due, and try and see if we could get consent from these parents. So that was sort of the first lockdown that we spent time doing. We just started with social media just before lockdown, around end of February. So we set up a Facebook and Twitter page, and we decided to utilise that as well to see if we could get the message out there. And that worked amazingly well to get those parents contacting us to consent for those vaccinations. So I nominate the immunisation team because of how we've adjusted to the way of working during this year, how we've had to change the ways that we do certain things, the way that we've had to adapt. If the immunisation team won this award, it would be recognition, I think, and that's just recognition for the team, of the hard work that they've put in, of the time that they've spent coming in off annual leave, coming in off days off, and just that recognition that that we've achieved something, and that we've actually been recognised for that. And I just think that it would just be a massive uplift, a massive morale boost as well, I think.
I'm Tabani Songo. I'm the Operations Service Manager for Adult Inpatients Mental Health. So I cover the wards at Linfield Mount Hospital and the wards at Airedale Centre for Mental Health. To be nominated by Kelly Barker, our General Manager, as the Team of the Year was a massive boost, and remains a massive boost regardless of the outcome. I think for us as a team, standing back and just reflecting on how everybody's pulled together, working through this pandemic that we're still working through, but supporting each other, providing opportunities for staff to still learn and develop despite that difficulty, has been a massive boost for us. Put things into perspective, really. I think we all always worked under pressure and impatience, and that's one of the badges that we wear, that we tell everybody that we'll listen, that we're always under pressure. But this presented a whole different dimension. And I think for us, it gave us the opportunity really to show even more extra resilience and I suppose strength in our teams that would have probably never demonstrated with this. So upsides of this, I think it brought the inpatient teams to the attention in the forefront, I feel, for the organisation and maybe the wider community about the work that we're doing. And in turn, we've had remarkable support, be it equipment, be around people who've gone off sick as a result of COVID. The level of support that we've received has been absolutely commendable. as a team, if we win this award, it will be a moment for us to stop again and absolutely celebrate, because again, we've not had a lot of opportunity to celebrate all the achievements that we've had in the last year. This would give us an opportunity really to get together and I think stand side by side and celebrate. And I think even though it's for the inpatient team itself, hopefully it will allow us again to celebrate with other parts of the organisation who've stood side by side with us in getting through this difficult time.
Wasn't that great to hear? Okay, so without further ado, now open the envelope. See who's the winner. Winner of Team of the Year is the Acute and Psychiatric Intensive Care Unit for Airedale Centre for Mental Health and Linfield Mount Hospital. Very worthy winners, I'm sure you'll agree. Well done, team, you've been outstanding. So congratulations to you and thanks to all our Team of the Year finalists for all you've done in these challenging times. Now I'm going to ask our Director of Nursing Professions and Care Standards, Phil Hubbard, to present a very special one-off new award for Eurostar Awards 2021, reflecting the unprecedented situation we've all found ourselves in. Over to you, Phil.
Oh, thank you, Patrick. Yes, we simply couldn't let this momentous year go by without looking back. We're now going to watch a short film which gives us a brief moment of remembering and reflecting on what we've all been through, the sad losses we have seen and experienced at home and at work as individuals and teams. Let us all remind ourselves of the positive moments, what we've achieved by pulling together in the face of COVID-19. But here, just some of the things that we've been part of.
I was part of the quality improvement event last week for care planning and risk assessments.
At the end of this week, I feel hopeful and I feel heard.
Real excitement that we've got in the organisation today that we're going live with our vaccination at Linfield Mount. It's such an important day for us because it really gives us a little bit of hope that will take us forward out of this pandemic.
Hi, I'm Sarah. I'm a nurse and I've just recently come back to the NHS to help out with the vaccination programme. It's a really important piece of work to be involved in because so many lives have been affected for so long. It's important to get as many vaccines out as soon as we can.
Hi, I'm Jazz. I'm the Chief Pharmacist here at Bradford District Care Trust and I'm here today at Jacobswell where we're just about to go live with our community vaccination clinic. Can't tell you how proud I am to have been part of this project to vaccinate the population of Bradford. It's been a journey. Lots of people have been involved, nurses, team leaders, pharmacists, it's me, estates and facilities. The whole trust has come together to get this up and running for the population of Bradford and I for one can't wait for my family to come and be vaccinated here. Just really proud to be part of the whole thing.
Finally, from me, from the board, from the exec team and from the senior leadership team, thank you for everything you continue to do for us every day. You are absolutely fantastic. You are amazing, you are resilient, and we will absolutely get through this together.
Well, I don't know about you, but watching that certainly brought a tear to my eye. I echo Therese's words on that film. Thank you to everyone, teams and individuals, clinical and non-clinical, service users, carers and volunteers, absolutely everyone who has played their part in helping colleagues and those we serve get through this year. As there are several individuals and teams who have just about every aspect of their day-to-day work has been impacted by this pandemic, and it's them we are recognising today with the COVID-19 award. Let's find out a bit more about them.
My name is Sarfraz Shora. I am a consultant psychiatrist in the Psychiatric Intensive Care Unit at Linfield Mount Hospital. In my day job, I work on the Psychiatric Intensive Care Unit, and I sort of support patients who are having mental health difficulties, and they're of a nature and degree where they need intensive input. And that is what I provide along with my team on the Psychiatric Intensive Care Unit. I think it's a privilege to work in the NHS, and being sort of nominated for the You Are a Star Awards is a privilege and is an honor because there are more than 3,500 colleagues who work for Bradford District Care NHS Foundation Trust, and then being nominated, I think it is an honor. But at the same time, although sort of I have been nominated for the award, but it is there's my team which is sort of part of this award, from sort of nursing colleagues to doctors to healthcare support workers to pharmacy to occupational therapy to psychology to admin staff to porters to housekeeping. Although my name has been put forward for this award, but without my team, I would not have been able to sort of provide the care which we have in these difficult COVID times. If I win this award, I think it will be a great honor for me to have won this award, but at the same time, it would be a great honor and something we would celebrate as a team. We have had a very difficult sort of past 14 months, and without my team, we would not have been able to pull through.
I've nominated Samantha and the team because they have been an absolute fantastic resource and support, not just for us as a trust, but across our system. That has included them setting up staff testing sites across Linfield and Marley Fields in Keighley.
This past year, back at the start of the pandemic, I was involved in collaborative working to set up a COVID-19 swabbing site. It was the first in the district, and we've swabbed over 44,000 people.
They've also, during this period, done the flu vaccination, which they do every year, but I've done that in conjunction with providing advice and support to clinical teams.
Working in infection prevention this past year has been probably the hardest year of my life. With during the pandemic, infection prevention has been key piece of work throughout the organisation. So to be nominated for this award, I was quite shocked and overwhelmed by it, really. And it's not just about me, because there's no way I could have worked this year without the support and dedication, in particular of Natalie and Jill, but all the other staff members that have been redeployed and worked with me on Staff Bank. It's been a great team effort, really, really challenging year, but everybody's supported me to get to where we are now.
I feel that, they're a team that are kind of behind the scenes, working tirelessly to really achieve this. And support the organisation, and I'm immensely proud, but I also want them to be immensely proud.
Hi, I'm Delphine Fittery. I'm the head of informatics for Bradford District Care Trust.
and I manage the informatics team, which is the IT department, clinical systems, and information governance. I nominated the team with all the senior informatics manager because they've done a great job over the COVID period and in preparation to that as well, without knowing that they were putting all that work for. We did have teams already in place, so the transition was much easier in order to enable other staff to kind of work from home. But also we supported all the other services to work remotely. We provided them with a lot of equipment as well in order to do that. We've been very kind of proactive as part of that, and we've been supporting the teams as well from kind of specifically for COVID purposes, developing a System 1 templates and unit as well in order to support the team to provide that services within people's home as well. So all around the whole team, and we couldn't pick an individual or a specific team, but we saw that everyone really put his weight and really worked together as a team and thought about others before thinking about themselves. And therefore really thought that it was key for them to be recognized for all the hard work they've done during that period.
Right. Without further ado, let's find out who the winner is. Samantha Morehouse and the Infection Prevention Team. Very well done, Sam. I'm absolutely delighted for you. I think it's well deserved, and I think it's fair to say that the Trust would not have gone through this pandemic without your positivity, hard work of you and your team, the training and everything that you've done, including the vaccination programme. Congratulations. Now I'm going to hand over to Therese to announce the overall winners for our Living Our Values Award. We care, we listen, and we deliver. Thank you.
Thank you, Phil, and well done, Sam. Each and every month, you all nominate colleagues who have truly lived our Trust values. We care, we listen, we deliver. Today, we announce an overall winner in each category. But before we do, I want to thank the people who take the time and trouble to nominate and to congratulate each and every one of our monthly Living Our Values Award winners. Now it's time to shine a light on those who have truly demonstrated our values in an exceptional way over the past year. Let's start with We Care. This award is for staff who are shining examples of respect and empathy, compassion and kindness. And I'm delighted to announce that the winner is Chris Antigre. Very well done, Chris. Chris is part of our early intervention in psychosis team and has worked with service users during lockdown on creative writing projects, including a nativity play for BCB Radio. He is persistent and patient, as well as caring and creative. He has continued to carry out one-to-one work and to engage with outside agencies despite the pandemic's restrictions. Chris previously struggled to engage in meaningful activity, but is now confident and proud of his achievements. He certainly did not let the barrier of reduced face-to-face contact stop the wonderful work he's been doing. Congratulations, Chris, on being our We Care winner. The second of our Living Our Values Awards is We Listen. Listening is central to all we do, taking time to understand different people's circumstances and views so that we can then respond effectively to their needs. Our winners in this category realise the importance of listening as part of making meaningful change. And the winners are the dental team: Anne-Marie, Rahima, Nadia and Sharon, working alongside Leroy Golding, Chair of our Aspiring Cultures Network. Congratulations to you all. You've absolutely demonstrated the We Listen value. In response to the Black Lives Matter movement, the dental team, supported by Leroy, undertook a series of engagement events with all dental staff. Staff shared their personal experiences in a series of open and honest conversations. The aspiration was to create a movement and to replicate this listening approach across the Trust and beyond. And now to our final Living Our Values Award, We Deliver. For this award, we have another team who found new and creative ways to deliver a great service despite the pandemic. The Wadi Loves Learning Disabilities Health Support Team members, Michelle, Charlotte, Noel, Jeanette and Tracy, together with service user Jack. This enthusiastic group wanted to ensure that people with learning disabilities and service providers across the district could keep up to date with news and information from Wadi Loves during lockdown. They created an easy read newspaper which proved a big success. More recently, they've been working to support people with learning disabilities to share their stories and important healthcare experiences, such as having a COVID-19 vaccination or going through cancer screening. They have really delivered. Well done to all of you. I'll now ask Kathy to say a final few words as we reach the end of what has been, I hope you'll agree, a truly inspiring awards ceremony.
Thank you, Therese, and thank you everyone for watching this Eurostar Awards 2021 online ceremony. I hope you'll agree it's been an inspiring event celebrating the hard work, dedication of outstanding staff, volunteers, carers and people who use our services. Today we have truly seen how we deliver better lives together and embody our values of we care, we listen and we deliver. In a really challenging year, I'm sure you'll agree it's been uplifting to hear about the successes and the positives that have come out of adversity. And as we emerge from the restrictions and face whatever the new normal will be, I know that plans are underway to consider how to best move forward, taking on board our learning and our experiences and the views of everyone who's part of the Trust. I think you'd agree that thinking outside the box has very much become common in our teams, and new ways of working have been embraced and welcomed. And the resilience of you all in the Trust has been very much seen by myself and board members, and the ability to get things done no matter what has been demonstrated again and again across staff and services. Thank you so much. You all do an amazing job. You should be incredibly proud of yourselves. And that's whether you're working in the front line or behind the scenes, you all have vital roles in making this Trust a success. Thank you. So as we finish and bring to a close our ceremony, I particularly wanted to thank our supporters again, Sovereign Healthcare and Taskmaster Resources. As I've said before, we couldn't do this without you, and we very much appreciate the many years of support that you've given the Trust and this awards ceremony. Thank you. Thanks also to our judging panel and those involved in the shortlisting. With a large increase in nominations this year, it's been a tough job to select our finalists and winners, so thanks for your time in helping us. So as I draw the event to the close, I encourage you all to carry on celebrating, and you can do that and connecting together on social media using the hashtag YASA21. I want to say congratulations to all the nominees and all the winners of the Eurostar and Living Our Values Awards. I hope you enjoy celebrating. You are what today's event has been about, your passion, your commitment and your willingness to go that extra mile. Thank you very much. Enjoy celebrating.